In the case study of fatty liver presented in the first part of this video, excess fat in liver was a manifestation of Vimarga Gamana of Abadha Medas due to intake of excess Rukshoshna Nidana, and it was successfully treated by administration of Snigdha Sheta Rakta Pitta Hari Chikitsa. But will this diagnosis and treatment approach hold good to all cases of fatty liver? Let's try to answer this question through another case study of fatty liver today. A female patient aged 25 years and chartered accountant by profession had consulted with complaints of irregular Artava Pravritti, that is once in 3 to 5 months since menarche, that is 10 years back, gradual Atishaya Vruddhi of Sharira Parimana, especially in the region of Udara and Spec since 10 years, that is excess weight gain, mainly in abdominopelvic region, Atiyoga of Kshudha and Pipasa since many years, Atishaya Alasya, Guru Gatrata, Nidra and Tandra since many years. The weight of patient was 95 kgs when she had consulted, and the prakriti of the patient was found out to be Kapha Pittala. She had a very strong maternal and paternal family history of obesity. USG findings in this patient revealed that she had steatohepatitis and PCOD. Regarding medical and treatment history, the patient had discontinued all allopathic medicines in the recent past as she had found no relief after taking those medicines for 1 year. On evaluating the Nidanapurvaka Samprapti in this case by deep and long interrogation with the patient, it was observed that long history of avyayama, divaswapna, atisevana of shleshma medo vardhaka ahara, that is products of cheese, sweets, oily items and ice creams in excess since many years, along with bija swabhava, that is strong family history of obesity, and kapha pradhana prakriti of the patient had led to atishaya vruddhi of shleshma and medas, giving rise to all typical lakshanas of sthaulya, that is vruddhi of sharira parimana in the region of udara and spik, atiyoga of kshudha and pipasa, etc. All these are the pratyatma lakshanas of sthaulya. Since it was a typical case of sthaulya hara chikitsa was administered to this patient. 3 cycles of udvartana for 8 days for each cycle, with a gap of 1 to 2 months between each cycle, was administered. Kolukuluttadi churna and Triphala churna was used for first cycle, Triphala and Haridra for second and third cycle. And after this, Snehapana Purvaka Vamana was administered, that is after 3 cycles of Udvartana. Indukanta Grita was used for Snehapana. Samyak Snigdha Lakshanas was observed after 5 days of Snehana. Abhayamalaka Taila was used for Abhyanga, that is Purva Karma of Vamana. And in Vamana, patient had 6 Vegas. And after 2 months of administration of Vamana, Snehapana Purvaka Virechana was administered. Same Sneha was used for Snehana, that is Indukanta Grita and Abhayamalaka Taila for Abhyanga. Virechana was administered using Trivrit Lehya in this case. Patient had 15 Vegas in Virechana, and after a month of Virechana, Yoga Basti was administered, wherein Dashamula Kwatha was used for Niroha and Tila Taila was used for Anuvasana. After the Parihara Kala of Shodhana was over, patient was advised to take these Shamanaushadis. Navaka Guggulu and Abhayarishta thrice daily for 4 months. Ahara and Vihara was very strictly advised to be so. Patient was advised to completely restrain from all Shleshma Medo Vardhakara Ahara and Vihara, that is milk and its products, Masha and its products, Pruthuka, fruit juices, all food items which are cold by nature or temperature were avoided. Patient was advised to take Ushnodaka only for drinking, except in Ushna Rutu. Patient was advised to take preparations of Yava during any one of the meal times. Patient was advised to exercise daily until proper Vyayama Lakshanas appeared. As expected, the outcome was so. Artava Pravritti was regularized, that is, the patient started to have proper Artava Pravritti once in every 40 to 45 days after 3 cycles of Udvartana. Steatohepatitis got transformed to only steatosis after 3 cycles of Udvartana. Gradual weight reduction, that is, patient's weight reduction was observed to be a total 7 kgs in a time span of 1 year. And for a special note, all the advised Ahara and Vihara was very strictly followed by the patient throughout the treatment. In fact, the patient was very much Bhishak Vashya. She cooperated very well throughout the treatment. USG findings of PCOD and fatty liver was reversed to normal only after all these Shodhana and Shamana Aushadha duration was completed, after the whole course were completed. Now the question of concern is, how was reversal of PCOD and fatty liver achieved in this case without administration of Artava Pravartaka formulations or Yakrat Uttejaka or hepatoprotective aushadhas? And how was it possible to attain complete normalcy only by administering gross Sthaulya Hara Chikitsa? A verse from Sushrata Samhita Sutrasthana 15th chapter would answer this question, wherein the third line of this verse says, Avrata Margatvadeva Shesha Dhatavo Na Apyayante. That is, only because of excess accumulation of medas in all the srotas of a sthula patient, the other dhatus will not get produced in proper quantity and quality. And hence, even in this case, PCOD and fatty liver were the consequences of sthaulya only. To be more specific, PCOD was a consequence of margavarodha caused by vruddha medas in artava vahasrotas, leading to artava apravritti and cystic appearance of ovary. Steatohepatitis, that is fatty liver, was a consequence of atishaya medo vruddhi in udara. That is, just like there was excess accumulation of medas throughout the body of the patient, there was excess accumulation of medas in the moola of raktavahasrotas, that is yakrat 2. And hence, even in this case, these other conditions, that is the USG findings, are the consequences of the main existing vyadhi, that is sthaulya. And finally, fatty liver in this case was found out to be a presentation of Medo Vruddhi. So it can be concluded that fatty liver, not like in the first case wherein it was treated by Snigdha Shita Chikitsa and it was diagnosed as a condition which was secondary to Vimarga Gamana of Abadha Medas. In this case, it was a condition or a consequence of Medo Vruddhi, and it was treated typically by Medo Hara Chikitsa. So the message from both these case studies is that a condition that is said to be having similar cause and similar treatment for everybody according to Western medical science might not have similar causes and similar treatment protocols according to Ayurveda. Like in the case study of fatty liver that I have presented, fatty liver presented both by Santarpaka Nidana and Apatarpaka Nidana, and it was treated successfully both by Santarpana Chikitsa and Apatarpana Chikitsa. Thank you for now. Stay connected for further updates.